At the beginning of the 21st century, we realize that none of the chronic diseases, cardiovascular disease, cancer, high blood pressure, or diabetes, have been eradicated by using conventional pharmaceutical medicine methods. Even more, economic basis of the pharmaceutical business, which is profit-oriented, relates to the constant expansion of disease markets. And we have to realize that this pharmaceutical business, this principle of the pharmaceutical business, is the biggest obstacle to real health innovations, discoveries that result in the elimination of these chronic diseases. And here you can see the graph that comes from the pharmaceutical research and pharmaceutical data showing a drastic decrease in new drugs that have been put on the market in the last few years. And we need to realize that any effective, sustainable healthcare system must include science-based natural health. And today, I would like to present to you, share with you, the results that come from the work of our research team, from Dr. Rath discoveries that show the foundation for building effective healthcare system in America and in other countries. So how our work has contributed to building this new healthcare system. First of all, defining the root causes of diseases. Without knowing what is the reason, what is the cause of the disease, we cannot effectively eliminate disease. The second, based on Dr. Rath's discoveries, we can correctly define therapeutic targets for many diseases. Heart disease, which shifts its target from too much cholesterol in the blood to the stability of the blood vessel wall. And in cancer, the therapeutic target is being shifted from killing, eliminating cancer cells with powerful toxins to preventing their spread by reinforcing extracellular matrix. The other aspect is effectiveness of natural approaches. And as a first, we introduced the application of nutrient synergy, which allows to achieve much higher biological effect using lower doses of specifically selected micronutrients. And the fourth aspect is education, knowledge. Public education, public knowledge of how our body works, what cells that build our body need for optimum health is the basis of sustainable changes in healthcare. Recognition of the root causes of diseases. Already 20 years ago, Dr. Rath came with an explanation how chronic diseases develop. And their roots are chronic, long-lasting, decade-lasting deficiency of vitamins, minerals, and other essential micronutrients, which lead first to metabolic malfunction, cellular pathology, organ disease, and the disease spreads over the entire body. And therefore, by knowing what causes these diseases, we know the most effective way to control them is to eliminate those long-term deficiencies of micronutrients. Therapeutic targets, new effective therapeutic targets of diseases. Heart disease. Dr. Rath's discovery challenges the old fortress of cardiology that cholesterol is the cause of heart disease. Cholesterol is not the cause of heart disease. Cholesterol is the consequence of heart disease. And knowing and following, finding the effective approaches using this therapeutic target, which will lead to elimination or significant reduction of heart disease. So Dr. Rath and our research established the link between long-term vitamin deficiency in the vascular wall and increasing cholesterol level in the blood. So vitamin deficiency, especially deficiency of vitamin C and many other micronutrients that are essential for building collagen, the cement substance for the vascular wall, leads to instability of this of blood vessels. Blood vessels develop crack and lesions that need repair. And as a response, biological response, our liver increases cholesterol production. Cholesterol acts and works as a repair agent to fill in those cracks in the wall in a similar way like mortar fills in cracks in the brick wall. So as a result, cholesterol level increase, and since cholesterol has to deposit in the weakened vascular wall and with time can cause formation of atherosclerotic deposits and leads to pathology that culminates with a blockage of blood flow and heart attacks or strokes. Therefore, the cause of atherosclerosis or cause of heart disease is overshooting repair mechanism of the blood vessel walls. And therefore, what is the effective approach to control heart disease? From one side, and the most important one, is to increase the stability of vascular wall, which can be done very simple with supplementation of vitamin C and other critical nutrients. At the same time, vitamin C and many other nutrients can regulate the production of cholesterol in the liver, and therefore the biological effect can be obtained. Our scientific work that we've been doing for more than a decade substantiates and show scientific and also clinical proof that micronutrients acting in a specific teams are effective in controlling every stage of the development of atherosclerosis, starting from the initial stages and ending at the most advanced stages. So we have shown, and we published these results in many scientific medical publications. The results show that micronutrients in specific combination can prevent or control deposition of cholesterol in blood vessel, which is the hallmark early stage of atherosclerosis. They can control building up of vascular fibrous cap in the blood vessel and prevent proliferation of vascular cells. It can decrease also the calcification of plaques in the blood vessels, and micronutrients can also control the most critical step, which is the rupture of atherosclerotic plaques that can cause heart attacks and stroke. We have also shown the micronutrients are effective in alleviating multiple risk factors, including genetic predisposition to heart disease, combined with other cardiovascular risk factors such as blood pressure. And here I will share with you some of the studies that substantiate that. Here you can see the blood vessel, the artery isolated from an animal with a genetic background that makes it susceptible to heart disease, and also which has high blood pressure. And these animals were kept on the diet containing only standard amounts of micronutrients. As you can see, this arterial wall was full of fatty deposits showing that atherosclerosis was already developed. However, the same animals, the same type of animals with a genetic background predisposing them to heart disease and with high blood pressure, but kept on the diet containing micronutrients, have their artery cleared. So we could see that even in such severe conditions, micronutrients are able to decrease deposition of cholesterol in the artery wall. At the same time, this micronutrient supplementation is effective in lowering cholesterol level, blood cholesterol level. Here you can see that total cholesterol decreased by almost 32%, LDL by 65%, and HDL, LDL ratio increased, which is the positive effect. Micronutrients, in addition to decreasing the deposition of cholesterol in the arterial wall, also were effective in preventing hemorrhages inside the arteries. On the left-hand side, you can see that on animals on controlled diet had the arterial wall full of hemorrhages, while the arterial wall of the in animals that were kept on the diet with micronutrients had very few hemorrhages. What do these select results mean? That micronutrients have multiple benefits in increasing risk of heart disease, even in the presence of several risk factors at the same time, such as genetic predisposition and high blood pressure and many others. Clinical proof of the effectiveness of micronutrients in stopping the progression of heart disease and even in reversing of already existing deposits has been published by us already in 1996. And this was the first in medicine, first in history of medicine, clinical documentations that calcified plaques can be even reversed in the presence of selected micronutrients in the diet. And here you can see the computed tomography scan showing the presence of arterial deposits and the absence in individuals who consume the micronutrients-enriched diet already after 1 year. These results have been published and they are also present. They are available in Dr. Rath's book, Why Animals Don't Get Heart Attacks, but People Do. In our research, documented in clinical studies that micronutrients, the specific combinations of micronutrients, are effective in lowering high blood cholesterol level, in lowering high blood pressure, decreasing arrhythmic episodes, improving conditions in heart failure patients, and also in normalizing blood sugar levels. All original information results are available on our website.